Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
Welcome back into Good Morning Arkansas. Dr. Morgan Sauer from the Longevity Center at St. Vincent joining us now. Thanks so much for coming in, Dr. Sauer.
It's great to see you.
Okay, now we're talking about blood pressure today, specifically high blood pressure, low blood pressure, and some of the different causes and some of the concerns and effects that can later happen if you don't get those treated. First, let's talk about something like low blood pressure. And there's more studies being done on this right now, but sunlight affecting low blood pressure. How exactly does that work?
It's really interesting because most people think, well, sunlight, that makes vitamin D. That must be the cause. No, it's actually another reaction that happens even before vitamin D kicks in, that nitric oxide is released from the skin. And we know that nitroglycerin, nitrous oxide, actually causes the blood vessels to expand. So when your blood vessels get larger, there's less pressure, just like the pipes at home.
Interesting. Okay, now this one really caught my eye, this next one here. It's a visit to the zoo.
Yes.
What exactly does that do, and how does that work with blood pressure specifically?
It's amazing because there's actually other studies that correlate with this, with fish tanks.
Really?
Watching fish and how that can lower blood pressure. And for some reason, humans watching animals releases the parasympathetic nervous system. It activates this system, which is your calm down system. And so it creates a feeling of calmness, a feeling of pleasure, much like you get after eating a meal, and it brings your blood pressure down.
That's it. Maybe watching in a closed environment, having animals at the same time, if they're not a puppy, as long as they're trained, and that might help too, I guess. But definitely watching them like that, I never thought of that before. That's very cool.
Or as long as you're not a grandparent trying to explain what those 2 animals are doing to your kids at the zoo.
Yes, exactly. Yeah, that's for sure. All right, let's talk about adults who volunteer and their correlation with high blood pressure. Is there a significant difference in that if you're out there in the community volunteering?
There is. People who volunteer at least 200 hours a year, which is about 4 hours per week, have much lower blood pressure.
Really?
And probably it's a psychological thing, how helping other people and seeing other people in pretty much worse shape gives you a positive feeling about yourself. This releases natural chemicals in the brain, natural pain release and pain controls mechanisms that make you feel better and bring your blood pressure down.
Okay, now one that you hear about all the time, especially if you do yoga or any of those classes where it's all about finding your peace, the energy. Meditation. Is it truly something that could help with blood pressure and maybe lower it a little bit?
Yes, meditation can work really well, but also meditating in a high-stress environment. So say, for instance, work. You're in your chair at work, and you actually take some time to meditate. You will actually drop your blood pressure, but what you're doing is you're de-stressing your environment. You are training your brain to be unstressed in a stress environment. Stress brings blood pressure up. De-stressing brings blood pressure down. So you're training your brain to think that this is a de-stressed place. So it can actually improve performance too.
Really? See, that's interesting. It's not something you just want to do after work or before work. You could actually take a little bit of time, at least during the day, to find some time to meditate to help lower your blood pressure.
Sure, 15 minutes is all that it would take to do that.
Really? Okay, very cool. This is an easy one. Hugging your husband or wife, I guess.
Yes.
That's one that'll help.
Yes, there is definitely a unique feature in humans that when we touch other people and we feel warmth from other people, that it actually produces a pleasure sensation. It provides a sense of safety, security, community. It's probably a leftover from our past, and that gives us a sense of peace and belonging. And people who have that sense of peace and belonging actually do much better.
This next one might depend on what kind of music, but listening to music, I guess, is one we've heard too before. But it's something that as long as you're listening to the right kind of music at the time and it's appropriate, it could also help out with blood pressure.
Yes, there were some Japanese studies that actually looked for people who are not musicians who listen to music actually did have a decrease in their blood pressure. My father would beg to differ after being stuck in the car with me listening to my music. Exactly. But we got there a lot faster.
There you go. There you go. And I'm sure if any parents have teenagers out there right now, they're thinking not that type of music, maybe some of the older style music that you liked whenever you were a kid. All right, this last one, hand exercises helping with blood blood pressure. What exactly are these hand exercises and how do they help?
Getting those the grip, the grip handles that we've all seen. We always joke, in the 70s there were the iconic exercise thing of doing the grip handles. Those actually have a functional purpose.
No kidding.
And if you use the gripping for about 2 minutes, switch sides and do it for 2 minutes, and do this for a repetition of about 12 to 15 repetitions, it actually causes the muscles to tighten, and then when the muscles relax, it helps shunt blood into the arms. And so when you open up and you bring more blood in the arms, there's not as much other places, and that helps drop the pressure in the core and in the brain.
Very cool. Some great tips today if you're looking to lower your blood pressure and it is to a point where you're getting stressed and it is too high. Make sure you call your doctor too. That is always important. And you can always contact the Longevity Center at St. Vincent. You can talk to Dr. Sauer or any of the fine folks there that will help you out and make sure that you are not living a high-stressed, high blood pressure lifestyle. Dr. Sauer, thanks for coming in today.
Just don't stop those pills unless you call first.
That's right.
Most important.